To hear the full episode, become a patron at patreon.com/deathpanelpod.
Welcome to the Death Panel. And before we get too far into it and I do our preamble, you probably notice something a little different. It's Artie here today. Beatrice isn't feeling well today. She's having a flare, so we're giving her a chance to rest. Ordinarily, in these circumstances, we might do something like re-air a relevant past episode, but, well, you know.
Crowds of current and former CDC staffers and their supporters lined the streets of Atlanta yesterday to recognize the officials who resigned in protest after the ousting of CDC Director Susan Manares.
Growing confusion over the COVID vaccine. CVS, the nation's largest pharmacy chain, is now limiting access to the vaccine in some states, even as COVID cases rise.
We are the sickest country in the world. That's why we have to fire people at CDC.
So with everything going on in the last few weeks, we thought it was important for us to weigh in. So today, I'm going to run through the itinerary that B and I had put together for today, talk about the latest goings on with the federal government and vaccines and RFK's hearing last week, and let B get some much needed rest. But before we get into that, patrons, thank you. Your support truly makes this show possible. We could not do any of this without you. If you value our work and want to help us keep the project going, become a patron. We rely on listeners like you to sustain the show. Join at patreon.com/deathpanelpod and get access to weekly bonus episodes and our full back catalog with hundreds of hours of bonus content. And to help us out some more, post about your favorite episodes, pick up copies of Health Communism, A Short History of Transmisogyny, and Abolish Rent at your local bookstore, or request them at your local library, hold reading or discussion groups, share the show with someone who needs to hear it, and of course, you can always follow us at deathpanel_. I'm Artie Vierkant, filling in for Beatrice today. And in just the past few weeks, the Trump administration has overseen a tremendous attack on vaccination and basic public health measures, spearheaded by HHS Secretary Robert F. Kennedy Jr. under the banner of his Make America Healthy Again agenda. And while the quick succession of developments in the last few weeks has drawn renewed scrutiny on RFK and the goings-on at agencies like CDC under the second Trump administration, including a high-profile Senate hearing last week, what we've seen is in many ways the culmination of months of clear intentions and well-telegraphed moves for the future of health policy in the U.S. Since the beginning of the year, RFK has managed to thoroughly stack top HHS roles with some of the biggest names in COVID pandemic denial, for example, from Jay Bhattacharya to Vinay Prasad. In June, RFK fired the entirety of what were then the 17 members of ACIP, an independent advisory panel that helps the CDC set vaccine recommendations and determine what shots the federal government will require insurers to cover. RFK has since replaced those members with people more aligned with his own agenda, including the new chair of the committee, Martin Kulldorff, who longtime listeners will remember as the co-author with Bhattacharya of the Great Barrington Declaration. And so this is the context into which, at the end of August, Trump's FDA issued new, dramatically narrowed recommendations on who can get a COVID vaccine, while around the same time pushing CDC Director Susan Manares out of her role, reportedly for refusing to pre-approve whatever the new ACIP decides, regardless of how specious. And as RFK has canceled some $500 million in federal contracts for future work on mRNA vaccines, and all of this coming, of course, just weeks before ACIP is supposed to meet on September 18th and 19th, which could even further expand attacks on basic vaccination. So today, we'll be focusing on two things. First, what's going on with vaccines, especially the COVID vaccines, and why it's so important. And then we'll be taking a look at RFK's Senate Finance Committee hearing last week and highlighting a few exchanges that tell us something interesting about the politics of the Make America Healthy Again movement, and especially the complicated and ongoing political fallout from key early decisions in the COVID response. Before we get to that, though, I want to just quickly say one or two things about RFK in general. For the purposes of this episode, we're going to assume that listeners are familiar with some of our broader take on RFK and the Make America Healthy Again movement, or the MAHA movement. If you're not, I think the best episode for that is called RFK, Health Capitalism and the Myths of Wellness. We'll put a link for that in the episode description. And that was an episode we recorded before Trump was even re-inaugurated and before RFK actually managed to clear Senate confirmation. And I think it basically shows that everything that's happened with RFK so far has been exactly what we were worried would happen with him in that role. But with that said, as a kind of meta show note for a second, I would be open to revisiting a sort of death panel general critique of Maha, if you will, if people were interested. The general principle would probably be the same, that basically Maha is a perfect encapsulation of how the actual systemic failures of the capitalist healthcare system, from how expensive and inaccessible basic care is for most people, to real environmental threats that Maha actually mostly looks away from while making up pretend environmental threats, to the kind of reactionary hollowing out of public health we saw in the early years of COVID, but also in the decades leading up to COVID. How those things are exploited with this bootstraps ideology about producing or winnowing down to a quote unquote healthy body politic, and how that exploitation is Maha's entire prerogative. So let us know if that's something you'd be interested in, revisiting a lot of the same critique to be sure, but maybe refining it a little bit now that we've actually seen what Maha looks like in power. And also because that episode starts with a lot of descriptions of various goofy behaviors that RFK has engaged in over the years, like the infamous whale carcass thing. And I think that individual level stuff is less pressing, perhaps, than a distillation of what makes Make America Healthy Again categorically a fascist or eugenic project. So let us know. Now, onto the topic of RFK in general. Here at Death Panel, we often say that replacing one official often will only do so much when the state already wants to do things one way, or when the person that they would be replaced with would probably do almost exactly the same thing. It's why, for example, replacing Rochelle Walensky with Mandy Cohen at CDC didn't, magically produce a better COVID response. This, I think, is different for RFK. With RFK, personnel really is policy. And this is what makes him probably one of, if not the most dangerous individual figures in power right now. And I say this because in recent days, especially during and since the Senate hearing last week, we've seen a lot of calls for RFK's resignation. And that's fantastic. Those are calls that should have been even louder earlier in the year before he was really able to get his hooks in. But also I think it presents a bind that we need to be realistic about. Because if somehow public opinion is able to bite off the head of Maha, then fantastic. But RFK has also already managed to put in place so many people that are also perfect examples of personnel as policy. People who we know from reporting that stretches back from before Trump was even re-inaugurated were handpicked by RFK and then rubber stamped by Trump. We've said the names so many times before, but it bears repeating. And this is not even all of them, but just a sampling. Jay Bhattacharya at NIH, Vinay Prasad and Marty McCary at FDA, cranks like Callie Means advising HHS at large, or Martin Koldorf now chairing the CDC's Vaccine Advisory Committee ACIP, all people with some of the most insidious and fucked up health agendas you can find, including literally the figureheads of COVID denial and let it rip public health measures. Trump didn't know who any of these people were, probably. If he did, maybe he had seen Bhattacharya on Fox News or something, one of the many times he was on. Obviously, there are dealings that the Great Barrington Declaration people had with Republicans in the Trump administration before in 2020 and everything like that. But I mean, for the purposes of staffing HHS, I'm sure that Trump was not thinking about this. This is an RFK mission through and through. RFK picked these guys specifically. And partly, I suspect, because some of them are generally speaking the kind of person whose entire public persona for the last 5 or more years has been dressing up eugenic and anti-vaxxer ideology in this language of doing your own research and informed consent, the sort of false idea that they're the true defenders of population health. As we talked about on the show before, this kind of perversion of the idea that they're champions for what they could call bodily autonomy, when the material impact of them being in power is actually one that's enormously deleterious to all of our collective health and well-being and strips bodily autonomy. And I say this because the way that these figures all operate is much the same as the way that RFK does, except that RFK throws in stuff about how teenagers are, quote, overburdened with mitochondrial challenges, or about how COVID is targeted to attack Caucasians and Black people and to spare Ashkenazi Jews and Chinese people. All these people that he's staffed up with might not say stuff like that or be as obviously objectionable at face value, but as a coalition inside HHS, they're a big part of what makes him so dangerous in the first place. So I think that's just kind of a good place to start with at the top, at a time when so many Democrats are calling, for example, for RFK to be ousted. Because yes, do that. But remember that RFK has also already set policy into motion through so many of these staffing decisions. These are going to carry forward even if he's removed. And if he's pushed out, many others will need to go with him. It's like a blight that has been allowed to spread, which is ironic because so much of RFK's prerogative is about chasing this idea that our bodies have been contaminated, whether by vaccines or most recently imagining that Tylenol is a quote unquote cause of autism, again, as though autism is a bad thing. But all of these figures being in power is a real contamination in and of itself, a real health threat. And the longer that RFK is there, the more it can spread. And I think this is borne out in, among other things, comments like the statement of one of the recently ousted CDC officials who subsequently posted on Twitter about what's going on at HHS that, quote, eugenics plays prominently in the rhetoric being generated and is derivative of a legacy that good medicine and science should continue to shun, unquote. To be clear, though, with RFK seated as the head of HHS, all of those people he brought in are additionally emboldened to do their worst. So getting him out is imperative, even if the next HHS head Trump would pick would undoubtedly be their own kind of danger. But rarely are monsters made like RFK. I have a hard time imagining Trump will be able to pick anyone capable of exacting even more harm as his replacement. Obviously, all of this is more or less theoretical. By all accounts, Trump is quite taken with RFK, giving him leeway to run with broad decisions that other agency heads don't necessarily get. Reportedly, Trump has privately bragged to people, I have a Kennedy, and within the campaign, they believed RFK's endorsement and his Maha movement helped him win the election, or sway the election at least, which honestly tracks with our assessment of the election from episodes like COVID Year 5 and the one that was called The Long Trump Era, which was our post-election show. Which is to say, there has been an unholy bond between MAGA and Maha that so far seems to have only offered each other power. And while we've said it before, it always bears repeating that combating either one of them at this point requires taking that alliance seriously. I don't necessarily think that you can split them up externally, as in I don't know that there's work that can cause a rift between them from the outside. Any rift, I think, would probably have to come from within at this point, probably. Which is one of the reasons that we've said before that really the only way you can beat a fascist project of health is likely with health communism, something that doesn't just ask people to bootstrap their way out of actually existing systemic health crises like pandemics or climate collapse or the injustices of the insurance billing model of health, but that actually addresses those things in a way that promises everything for everyone, all care for all people. Okay, so with that preamble out of the way, as promised, on to what's going on with vaccines. And there has been a lot, so this will not be entirely exhaustive. First, I'm going to run through what some of the changes were and a little on what some of the reaction has been, because in response to this, we have seen a flood of states rushing to either strengthen their own state-level vaccine recommendations or, in the case of Florida, taking this as a moment to go the other way and further devolve public health measures, while at the same time, health industry groups like the American Academy of Pediatrics and others have gone so far as to issue their own broader recommendations. And, I think it says something interesting about the force of the federal government, but also its porosity, that states are now issuing directives that healthcare providers can follow the recommendations of these independent bodies like the AAP in addition to or in the face of federal guidance. We're often highlighting here that the state's power is both in its control of the purse strings and in its ability to dictate authority, especially when big things like vaccine insurance coverage or whether certain treatments are licit or illicit are often set by a very small group of people within the government. So whether they realize it or not, or whether they ultimately use it this way or not, the fact that there's a widespread contestation of this otherwise pretty central federal authority could be a significant development, but that's a topic for another day, I suppose. So, at the end of August, after a long period of anticipation, some would say dragging their feet, the FDA finally updated COVID vaccine approvals, or in health industry speak, updated the label for the vaccines. Under the new approvals, this year's COVID boosters are designated only for people age 65 and up, or anyone else who has at least one condition that qualifies them as quote-unquote high risk for COVID. I'll come back for more on that concept of risk in a second, as I'm sure you can imagine. And to be more specific about what I mean about anyone with a high-risk designation, the FDA approvals are further narrowed for pediatric vaccines because at the same time, the FDA revoked the vaccine's emergency use authorizations, which had expanded access for them. So while the Moderna COVID vaccine remains available for kids 6 months and older, but with a high-risk designation, or through shared decision-making with a physician, the Pfizer pediatric vaccine dose is now approved only for kids 5 and older with a high-risk designation, and the Novavax vaccine for ages 12 and up. In past years, as we've talked about many times, these have been pretty blanket approvals, approvals for the entire population, regardless of so-called risk factors from 6 months of age and up. Early in the pandemic, at every turn, whenever it was possible to get the data together to approve a new age category, for example, the federal government would pretty quickly approve it. And every year since the first boosters, vaccine manufacturers have updated their vaccine formula to match their closest approximation of what might be the most common COVID strain circulating at the time, a process that is roughly analogous to the way that flu shots are updated every year to target whatever is the presumed dominant influenza strain that year. Though, as we've talked about some in the past, for the COVID vaccines, a lot of people have shared various criticisms over the decisions on what strain to target, whether that targeted variant would still be dominant by the time that the vaccines are actually being delivered. In that way, it's kind of similar to how flu shots work, which is as a best guess that doesn't always land perfectly. But this is all kind of immaterial background to the actual discussion at hand here, which is the point is they were available. And a COVID booster of any kind was better than nothing, particularly because COVID produces new variants so quickly, which is why it was important that throughout the country, at least theoretically, and according to the FDA label, anyone could get a COVID vaccine roughly once a year and let their immune system safely learn elements of, at the very least, some newer recent variants. So this new situation is a substantial decrease. And this led to RFK taking a victory lap, tweeting on August 27th, quote, "I promised 4 things. 1, to end COVID vaccine mandates. 2, to keep vaccines available to people who want them, especially the vulnerable." More on that in a second. 3, to demand placebo-controlled trials from companies. 4, to end the emergency. In a series of FDA actions today, we accomplished all 4 goals. The emergency use authorizations for COVID vaccines, once used to justify broad mandates on the general public during the Biden administration, are now rescinded, unquote. So obviously there's a lot of weird there. Number 4, for example, end the emergency. Biden ended the COVID public health emergency in 2023. And most obviously, of course, number 1, end COVID vaccine mandates. COVID vaccine mandates are, simply put, not a thing. Which, in fact, in prior years, COVID vaccination rates in the US have been pretty dismal, which was already a huge problem before RFK narrowed access. It's become astonishingly hard to find a halfway decent statistic on what percentage of the population have actually gotten a COVID booster year over year. But KFF have tried to track this somewhat through surveys. So according to KFF in November 2023, for example, roughly 20% of adults surveyed had gotten that year's COVID booster, with a further 13% reporting that they intended to get it. Other data suggests that that number hung around the 20s or low 30s. Similarly, this year, when surveyed about intentions, 21% of people said they would definitely get, quote unquote, definitely get this year's updated COVID booster, with a further 19% saying they would probably get one. But notably, this survey was released on August 1st, before the FDA put these new barriers in place. In essence, far from ridding the US of any putative vaccine mandate, which did not exist, this really just attempts to strip away access to something that was already only being given to, we can estimate, as many as 1 in 3 or as few as 1 in 5 adults, meaning it's essentially just cruelty, and cruelty that's only going to lead to increased population level vulnerability.
To hear the full episode, become a patron at patreon.com/deathpanelpod. You'll get access to this and the rest of our catalog of patron-only episodes, and be the first to get a new patron episode every Monday when it drops. With love, the Death Panel.